Hi, I'm Carrie Langstraat. I'm one of the gynecologic surgeons at the Mayo Clinic in Rochester, Minnesota. One of the common reasons we see patients for evaluation in our clinic is for a hysterectomy. There are many different indications for hysterectomy in patients. Some are for benign reasons, including abnormal bleeding, postmenopausal bleeding, fibroid uterus, and some are due to pain. And sometimes we see patients in addition for evaluation of gynecologic malignancies, including endometrial cancer, ovarian cancer, cervical cancer. All of these are great reasons for proceeding with hysterectomy. When we consider the surgical procedure for hysterectomy, we consider two main types of hysterectomy. One is to proceed with a larger incision on the belly and remove the uterus through a larger abdominal incision. A second method is to proceed with a minimally invasive approach, which involves either the use of the laparoscope to take all attachments down from above and remove the uterus through the vagina, or from a pure vaginal approach where all attachments are taken down from below and the uterus is removed through the vagina. When we approach patients to determine which type of hysterectomy is best for them, we favor a minimally invasive approach. Specific reasons to proceed with a laparotomy include large uterine fibroids, which would not be feasible to remove safely using a minimally invasive approach, or ovarian cancer is another common reason to proceed with pure laparotomy versus a laparoscopic or vaginal approach. I consider most of my patients, outside of those two reasons, a candidate for a minimally invasive approach due to some of the benefits which we have seen with a minimally invasive approach. My colleague, Dr. Bakkum, will talk more specifically about the pros and the cons of the two different types of approaches, as well as some of the more specific indications for laparotomy versus minimally invasive surgery.
Hi, I'm Bakkum-Gamez. I'm one of the gynecologic surgeons here at the Mayo Clinic in Rochester, Minnesota. First, I'll discuss the benefits of performing a hysterectomy through an open incision or a laparotomy on the abdomen. This is generally performed in women who are undergoing cancer surgery for ovarian cancer. The benefit in performing this operation through a larger incision is that your surgeon can be very thorough in exploring all of the surfaces within your abdomen and pelvis that ovarian cancer can spread to. Other indications for performing a hysterectomy through a larger incision include very large fibroids, which are benign tumors on the uterus that may make the uterus difficult to remove in a less invasive way. Aside from those two main indications, another reason that you and your physician may select open hysterectomy would be that of adhesions or scar tissue within the abdomen and pelvis from previous surgeries. Next, I'll discuss the benefits of minimally invasive surgery. Indications for minimally invasive surgery, which would be that of removing the uterus through the vagina or using laparoscopic assistance, include several benign indications, such as heavy vaginal bleeding, smaller fibroids, as well as cancer indications such as early uterine cancers and early cervical cancers. The benefits of minimally invasive surgery include that of shorter recovery time, lower risk of infection, less pain after surgery, and generally patients are able to return to work and other normal activities in a shorter period of time than if they'd had surgery through a larger incision on their abdomen. These are all options that a woman should discuss with her surgeon when considering a hysterectomy.